Good morning, everyone. I am Keisha Marie with your medical tea. My goal today is to inspire and educate our community about the importance of breast cancer awareness and the role of genetic testing by promoting early detection and prevention. You may ask why understanding matters. Early detection often means treating cancer before it spreads, leading to better outcomes. Awareness of your own breast anatomy and family history supports timely screening and genetic testing. Education empowers both men and women to recognize early signs, seek help early, and take control of their health. Another question you may ask is, how does breast cancer develop? Breast cancer begins when normal cells in the breast tissue changes and starts to grow uncontrollably. These abnormal cells form a mass called a tumor, which may be benign, which is non-cancerous, or malignant, which is cancerous. Common risk factors: age, family history of breast cancer, genetic mutation, BRCA1 and BRCA2, early menstruation or late menopause, hormone replacement therapy, obesity, and lack of physical activity. Recognizing signs and symptoms: lumps or thickening in the breast or under the arms, changes in size, shape, or appearance in the breast, dimpling or redness of the skin, nipple discharge or inversions, persistent breast pain. Self breast exams are most effective when performed consistently and at the right time. Some providers recommend monthly breast exams. The goal is to become familiar with your normal breast texture and appearance so you can detect any new or unusual changes early. Early detection saves lives. Starting at the age of 40, women have the options to start screening with a mammogram every year. Most insurance companies cover this cost at 100%. If breast cancer runs in your family, talk to your doctor before the age of 40 about starting screening early. Screening and diagnosis consist of the following: mammograms, which is an x ray of the breast for early detection, breast ultrasounds used for further evaluations, MRIs is used for high risk individuals, biopsies is a definitive test to confirm the breast cancer diagnosis, and genetic testing for individuals with a family history of breast cancer. Genetic testing and breast cancer. Genetic testing checks for inherited mutations such as BRCA1 and BRCA2. Helps identify individuals at higher risk for breast and ovarian cancer. Can guide decisions about preventative measures and treatment options. Counseling is recommended before and after testing to interpret the results. So, my White Oak Hills family, I wanted to talk to you today about my personal experience, share my testimony on the BRCA gene testing. So, 7 years ago, I decided to have the BRCA gene test done. I have a personal family history of breast cancer, and I watched my mom. She was diagnosed with breast cancer. I have an aunt that was diagnosed, so that's my mom's sister, was diagnosed with breast cancer. And watching my mom go through the battle of fighting breast cancer through the chemotherapy process, radiation process, watching her made me want to know, do I carry the BRCA gene mutation? So I decided to get tested. I met with my primary care doctor. She guided me through the process on getting the a generic the genetic testing, getting a genetic therapist. So what happens is I sat down with a genetic therapist. One of the things they asked me is, why did I want to know? I explained to them about my family history. And one of the questions that still stick in my head to this day is, okay, we test you, what are you going to do with this information? So mentally, it can be challenging, but I'm going to walk you guys through my process each year of what my doctors came up for me, and my treatment plan. So I met with a genetic therapist. They swabbed my mouth. It took maybe about 10 days for those test results to come back. And then I went back and met with the genetic therapist. Um, at that time, I was told that I carried the BRCA2 mutation. And the therapist got me an appointment with the breast specialist. I went and met with my breast specialist, and from there, my treatment process started. So, for me, what my treatment plan looks like every year and has been for the past 7 years is the beginning of the year. So, in January, I go to have my MRI done, and that's an MRI of my breast. And then 6 months later, I go for my mammogram. And in between those visits, I meet with the breast specialist, and we still agree on, okay, is this working? Is this not working? I know my advantages, disadvantages. I know my treatment plan. She closely monitored me. So I'm very thankful for her. So that's my process in going through it. I can tell you it can be mentally challenging, but even though it's mentally challenging for me, um, I lean on God and not my own understanding. I said, God, you created me. So you created me with these BRCA genes, flaws, and all. So I'm very thankful, but I do know the steps of what I can take to the next steps if I develop breast cancer. So I just wanted to share my personal testimony of the testing. When I say mentally challenging, sometimes too, when I go to have my MRI, I always think the what if. When I go to have my mammogram, I think the what if. When I'm doing my breast self-examinations, I think the what if. But I know who I serve, and I know that I serve an amazing God who created me with flaws and all. So I just wanted to share my personal testimony of getting the BRCA gene test done. All right, my White Oak Hills family. So you may be asking yourself, what is a BRCA mutation? What is BRCA? What is BRCA1? What is BRCA2? What is this crazy lady talking about? You may have all these questions. Well, I am here to try to break everything down for you. So starting, what is a BRCA mutation? A BRCA mutation is a change or error in one of the BRCA genes, BRCA1 or BRCA2, that affects the body's ability to repair damaged DNA. So everyone has BRCA1 and BRCA2. So everyone sitting at White Oaks Hills, everyone on this planet, we all carry the BRCA1 or BRCA2 gene. Normally, these genes act as a tumor suppressor, meaning they help prevent cancer by keeping the cell growth under control. The mutation occurs when these genes no longer function properly, and damaged cells can grow and divide abnormally or uncontrollably, eventually forming tumors, and this is how cancer is formed. So I wanted to break down what is a mutation. I also would like to explain what is BRCA1 and what is BRCA2, and what am I at risk for if I carry BRCA1 and BRCA2. So BRCA1 mutations, you're at a higher risk of breast and ovarian cancer. BRCA2 mutation people are at a higher risk of breast cancer, including males, ovarian cancer, pancreatic, and prostate cancer. So I wanted to break down the importance of what I feel like is important for genetic testing. Why I feel like if you have a family history of breast cancer, ovarian cancer, prostate cancer, why this test is very important. I wanted to break down and explain understanding what is a mutation and how cancer develops. So thank you so much. I just wanted to share that bit of a knowledge with you guys. Who should consider genetic testing? So, strong family history of breast cancer, ovarian cancer, and prostate cancers. Relatives, so when I say relatives, I'm meaning close relatives. So, like maternal mom, paternal father, siblings, grandmother, grandfather, aunts, uncles. Um, so, what happens with the genetic testing? You would know what mutation you carry, whether it's BRCA1 or BRCA2. So, you'll have that information. Also, with genetic testing, so when I had my genetic testing done, they gave me a form that I could have my kids, all of my kids tested. I could also give that information to any close relative, and they could go and get tested, and they would cover those family. They would cover the family as well. So I just thought, and I almost forgot about that information. I didn't get my kids tested because they were really young at the time. That was 7 years ago, so they were a little bit younger. So I didn't get them tested at the time, but they will give you that information so that you know. Also for genetic testing, so since I've had the genetic testing, my sister was diagnosed, one of my sister was diagnosed with breast cancer. My other sister had the genetic testing done. She does not carry the mutation at all. So I wanted to make it clear too also in this presentation that just because you have a family history, you may not carry that mutation. My oldest sister, she does not carry the mutation. So I just wanted to share that information with you as well. So I wanted to talk to you about how insurance covers genetic testing for breast cancer. Most health insurance plans, including Medicare and Medicaid, covers BRCA1 and BRCA2 testing when medically necessary. You can talk to your doctors. This test is a preventative screening. So most screenings and preventative measures are covered at 100%. Don't quote me on this, but talk to your provider. They can walk you through getting pre-certifications through your insurance companies and moving forward if you choose to get tested. So now that we've talked about common risk factors, signs and symptoms of breast cancer, breast self-exam, and genetic testing, I just want to talk a little bit on prevention and healthy habits. So some I have listed here is maintaining a healthy weight and a healthy diet, exercising regularly, limited alcohol intake. Smoking is another one. I don't have it listed here, but smoking is another one. I can't mention enough. Smoking tobacco is another one. Or smoking any substances. Let me put it there. I know none of us at White Oak Hills do that, but I just wanted to touch on that as well. Perform regular self breast exams, get routine clinical screening, and discuss genetic risks with your healthcare providers. And these are all ways that will put you at a decreased risk of developing breast cancer. Support and resources with any presentation that I do is key. I like to back my presentations up with statistics, facts, and testimonies. So these are just some of the resources that I use. If you want more or go into depth on anything that I mentioned today, these are the resources that I use. American Cancer Society, so it's cancer.org, Susan G. Komen Foundation, Komen.org, National Breast Cancer Foundation, nationalbreastcancer.org. You can talk to your doctor about genetic counseling through your local hospital or oncology center, or you can just use your primary care provider. I just like to always use facts and statistics. Again, I use my own personal testimony in these slides. So, my friends, together, let's spread awareness for breast cancer. Remember, encourage monthly self breast exams. Promote annual mammograms after the age of 40 or higher if higher risk. Support survivors and those in treatment. Participate in awareness walks, fundraisers, and health fairs. Remember, screening saves lives. Thank you so much. I am Keisha Marie with your Medical Tea.